A couple of interjections here, if I may. If you'll wait until you get the microphone, because the people from this side cannot hear over there and vice versa without it, number one. Number two, John, if you hold your hand up, has a list of those persons to whom letters would be effective if you were, in fact, to write them. If you want them, kind of indicate that to him, and he'll get that to you. Number three, show of hands for how many people would like to see the Tea Party create a list of these names, their contact information, and their business affiliations. Do we have any names? Okay, we'll do that subject to the steering committee's approval. And does anybody or has anybody contacted the former CFO, Jim Strong?
Yes. Let's see how to answer this. Jim wanted to help, but he couldn't. He wasn't permitted to help. I have a lot of respect for Jim. I'll leave it at that. But yeah, I don't want to say exactly what the interchange was, but Jim has nothing to do with this. We had good, clean audits every single quarter when Jim Strong was on board. Yes.
I have two questions. How could they make you leave the board meeting? How dare they? What right do they have to make you leave?
I'll answer your first question. The Vice Chief of Staff is Mark Davis, and he was sitting next to me when I announced for the second time that I was dismissed from the boardroom. And he just said under his breath, this is so outrageous, I've never seen anything like it in my life. I mean, they can't. And again, the purpose, they're going to say the reason I was dismissed is because I took part in the litigation. Here's what I did in the litigation. I issued a declaration saying I didn't think it was proper to go to critical access. So they said, this is Sutter Health's attorney, his name is Michael Duncan, he's a big-time attorney down in San Francisco. So Mr. Duncan said, the fact that you took sides in the litigation disqualifies you from being in the boardroom when we talk about litigation. But here's what really happened. When I was gone, they drafted a letter to the Board of Supervisors and the City Council in response to a very strong letter that our governing bodies had sent them. The letter said, on behalf of the Board of Directors, we assure you that we're interested in your concerns and so forth. I never even saw the letter. I didn't even know it existed until one of the City Council members called me and said, well, we got your letter from the board. And I was, well, what letter would that be? He said, well, the one that was written on behalf of the board. And I said, would you mind reading it to me so I can see what we said? I mean, this is how bad this is. And it is funny at a certain level, but when you're sitting in the boardroom and you have the Sutter Health attorney dismissing you, the Sutter CEO and chair agreeing with them, and the remainder of the board staring at their hands, it's a very uncomfortable situation. And it's happened twice now. And I know both times they conducted official business unrelated to any litigation. So I do have a problem with that. Yes?
Why can't the triplicate write up what you just said?
Well, I'd love to have that. I could show them, undeniable proof of all this. If they're interested, I'd be happy to tell the story. Yes?
I tried to talk to Mr. Strong, and he has a confidentiality agreement, so he's not allowed to talk about anything with the hospital. My other question is, you brought to light a lot of interesting information and accusations and misinformation presented to them. I think you said 30 times. That was wrong. On their list of names going around here, we have elected representatives, which I work for one of them, I'm taking a lot of notes. What about a hospital licensing type organizations, the people that actually are responsible for our care? Should we be writing to them?
That's a great question. The Joint Commission is in charge of hospital care issues, and I believe it's the California Department of Health Services that oversees licensing, and that we have not done that. So, this is why I wanted all these questions to come up. That's a great avenue that has not yet been explored and needs to be. I want to just mention briefly. I wasn't able to say this until recently, but now it's public. Sutter Health has applied for something called a Knox-Keene license. A Knox-Keene license allows a company to offer insurance products. In other words, Sutter Health is about to become an insurance company. And I'm very nervous about that based on their behavior up here. It will allow them to offer capitated products. That means global payments for patient services. In other words, your health care will be sort of paid in advance, in a sense, to the hospital or the doctors that work for them, and then any care they give you comes out of their pocket. It's sort of like if you had a contractor build you a fence and you said, I'll pay you $10,000 for the fence, but you weren't really specific about what you wanted in the fence. The incentive would be to put in a little bit cheaper materials. I mean, he wants to make sure he's got something left before the $10,000 is used up. And it's the same in medical care. I mean, that's basically what HMOs are. So this Knox-Keene license, if it's granted, will allow Sutter Health to offer capitated care up here. And before we go any further on that, I want to switch a little bit. I haven't even started Obamacare yet, but this is part of it. And it's going to tie into what you just said. So I'm not even going to come close to getting through everything that we said about Obamacare, but I think what Karen wanted me to do was talk about how it affects you and how it ties into this issue. And on one of your handouts, you're going to see the initials ACO. Has anyone ever heard of an ACO as it relates to healthcare? Does that make any? Yeah, most doctors don't know about them either. And it's only 6 pages of the 961 pages that is Obamacare. But ACO could be very important to our region. It stands for Accountable Care Organization. And it's basically like an HMO. It allows that capitated care to be offered. So instead of seeing a doctor and paying him for services through a traditional insurance product, the doctor and the hospital become capitated in the sense that they pay out of their pocket to give you care. So the incentive suddenly could become to not order the MRI or not order the physical therapy. There's a specific type of ACO called a pioneer ACO that is discussed in Obamacare. In the 6 pages, there's not much information, but in the 129 pages of regulations that go along with those 6 pages, there is a lot of information. And it turns out that Sutter is involved in this ACO issue. A pioneer ACO takes 5,000 to 15,000 Medicare patients, puts them in a group, and there's a global payment that's made to the ACO, which includes the doctors and the hospitals and all the lab tests, for the care of those 5,000 to 15,000 patients. I had this hunch that somehow this ACO could be related to regionalization, but I couldn't put my finger on it. I couldn't figure out why they're fighting this thing so hard. I mean, all we're asking is just leave us alone for a few years. We've been good to you. Why can't we just keep going the way we are? But there was the question I kept getting is, well, why are they doing this? I mean, they look terrible in the newspaper, and you're finding all this stuff on them, and now you want to get an attorney and go look at the books, and there's a lawsuit. And I think the ACO could be part of the problem. Now, I'm going to take the unusual step tonight of actually reading you some official minutes. These minutes are from my meeting, medical staff meeting. We don't hold closed meetings. We include people in things that are important. So, Dr. Tony Brer is a Sutter executive in San Francisco. And she came up to talk to our medical staff, basically to quell this resistance. We've been termed, what's the term, Kevin? The Rebel Alliance, right. 2 weeks ago, a bunch of employees came up and said, we've been told by our boss that you guys are now the Rebel Alliance. And I said, but weren't those the good guys? And in the same movie, wasn't there a Death Star? It was the bad guys. So we got a chuckle out of it. Anyway,